which is squeezing down on the bladder. That comes from weakness of the tissue. That comes from babies, pregnancy, vaginal delivery, hysterectomy, aging, loss of collagen, loss of elastin, stretchiness of the tissue, hysterectomies, gravity working on us for however many years we're here. And what happens is that when we cough, laugh, sneeze, the bladder neck is pulled apart and urine squirts out. So that's stress incontinence. Now, urge incontinence is a completely different animal. It has nothing to do with what you're doing, but what the bladder is doing. And if you all will remember, all of you have been around babies before, and most of you probably raised children. You know that you don't have to do anything to a baby to get them to urinate. You don't have to tickle them, you don't have to pinch their toe, it happens automatically, okay? So our bladders know how to function without our brain's participation. We learn to control that native reflex when we potty train, and hopefully we keep that the rest of our lives. But as you know, sometimes we don't, and that reflex begins to reactivate itself. And the reason for that, or the primary reason for that, is pelvic floor weakness. Because the way that we control these impulses that naturally come from our bladder is with our pelvic floor muscles. And our pelvic floor muscles, just like every other muscle in the body, weakens over time. And so as it weakens, we no longer have the strength to control those impulses. So the treatments for them are very, very different. Okay? So for example, overactive bladder, a common treatment is medications. It does not treat stress incontinence at all. Surgery for stress incontinence has absolutely no impact on the behavior of the bladder. So that's why it's really important for when someone comes in to see me that I kind of get the details of exactly what's happening with you in your body. When are you leaking? Is it that you can't get to the bathroom at night? The urine is running down your legs, when you're on your way to the bathroom. Or is it that when you're doing your water aerobics, you feel a squirt of urine? Does that make sense so far? Yes? Okay, all right. So how about if I just start with questions from here? Because I know we'll end up covering a lot of other things. But I want to cater it to what you want to hear about or what you want to learn about. Anybody have a question yet?
Yes. Are there exercises that you can do just on your own, or do you strengthening stress?
Great question. Okay. I'll tell you what, let me do this. Let me go over the treatments for both stress and urge, because I think you'll see where exercises fit in and where it doesn't. And the answer is yes. So anyway, for stress incontinence, the first thing we do is pelvic floor strengthening, and the simplest way to do that is Kegel exercises. The next step up would be formalized pelvic floor rehab, where we work with you to strengthen your pelvic floor. I kind of think of it as like physical therapy for the pelvis, okay? Then the third step would be some kind of anti-incontinence surgery, and there's several that we can talk about there. That's for stress incontinence. Now for overactive bladder, which is where urge incontinence falls in, the first thing we do there is pelvic floor strengthening, and then the next level would be formalized pelvic floor rehab. So at the moment you can see that exercise or strengthening the pelvic floor is the only treatment that actually affects both, okay? And then the second line therapies for overactive bladder are medications. And then there are third line therapies. There's 3 of them. One's called InterStim, which is kind of like a pacemaker for the bladder. We can inject Botox into the bladder. And there's something else called percutaneous tibial nerve stimulation, which is an office-based procedure. For those, we don't get to third line therapies unless we've tried the simpler things first. So to answer your question in kind of a roundabout way, exercises do help with all types of incontinence, or at least the 2 that I've talked about. Kegel exercises are the primitive basis for it, and anybody can do those on their own. The way you do that is you squeeze the muscle that you would normally squeeze if you wanted to cut off your urinary stream. Or I think a little easier way to think about it is you squeeze the muscles that you would use if you're afraid you're going to pass gas in front of another person. Okay? Because if you squeeze that, you will be squeezing your urinary sphincter also. Okay? The way you do it is you squeeze it, you try to hold it for 5 to 10 seconds, then let it go, and then repeat that 4 more times. So when you first start doing them, don't do more than 5 in a row. And the reason for that is your pelvic floor muscles are weak, and you can't strengthen a weak muscle beyond that. You need to kind of build it up slowly. So you do like 5, then an hour later do 5 more, an hour later do 5 more. Once you get to the 5th one and it feels strong, then you can add to them. What you'll see is you'll do the first one, you think that feels really good, that's a nice, good, strong Kegel. The second one, maybe not so good. And by the third one, it feels like spaghetti falling through your fingers. That's how you know your pelvic floor is weak and not to do more than 5. Okay? Does that answer it? Okay. All right, another question? Are y'all just still eating?
Well, I have another question, and it's about men instead of women, but even though you say you're generalized, it's not just, are you only dealing with women, or have you dealt with men too?
No, my training is in general urology. So now there are some things I have given up just because I'm in a group with 6 men who love to do all the male urology. So I tend to kind of pass some of that stuff on, but I still have male patients, and I still do kidney stones and bladder tumors and all of that kind of stuff. So I can certainly have a gander at your question. What was your question?
That was basically it.
Okay.
I just wanted to make for sure, because I mean, I'm sure there are some guys out there.
Sure. I will take questions from the gentleman or about men. Yes, ma'am.
Once you have a mesh put in, does the mesh work permanently, or will it have to be redone later on?
Excellent question. For most people, if you have a mesh repair, you should expect it to last. Now, that's not 100%. And the example I will give you that a lot of you all can probably relate to is hernia repairs. Back years ago, like if you had an inguinal hernia, the surgeon would take you to the operating room, we would put the fascia back together, we would do it in a couple layers with some sutures, and we would hope that it would hold the sutures plus the scar tissue. We all know in the old days, hernias recurred. Everybody had a hernia repaired like every 3 to 5 years. Then they started using mesh for hernia repairs, and all of a sudden, nobody needs a repeat hernia repair. So mesh is made of polypropylene, which is basically weaved suture. It's just weaved into a netting. The science behind how they weave it, how big the pores are, the size of the threads, all of that vary depending on what we're repairing. And the science is very specific about what we do in the vagina. The pores are very large, meaning, you know, like the holes in the net. And the reason for that is that we want blood vessels to be able to grow through there as if it's not there. And that's the key to preventing infection, because your body just treats it as if it's just a couple of sutures. It just kind of grows right by them and doesn't treat it as a foreign body. So the answer is a mesh repair is designed to last longer than a regular repair. But for example, in the literature for slings specifically, for a mid-urethral sling, which we use to stop stress incontinence, which again is leakage with cough, laugh, sneeze, the literature says that 87% of people are still completely dry 15 years after having it done. So it does hold up. Now, I probably do a repeat sling a couple times a year, and there are people who have higher risk factors. So for example, if you smoke, if you have COPD, if you do really strenuous stuff a lot, if you have diabetes or any kind of tissue connective disorders, anything that makes you a little bit less healthy, then your tissue is not as good. So you're more likely to recur. But the number is still going to be smaller than if we did a non-mesh repair. Does that answer it? Yes, ma'am.
If you pass a kidney stone, what are the odds of getting more stones?
Very good question. I quote this to people all the time. If you have your very first kidney stone, you have a 50% chance of having another stone in your lifetime. 10% within the year that you formed the stone. So you have 50% chance you're never going to form another stone again. The later in life you go without having stones, the more likely it is that it's just a sporadic stone and not a metabolic problem with the way you process things. So if you don't get your first stone until you're 65, chances are you just got dehydrated and formed a stone. Dehydration is the biggest risk factor for forming stones. Yes. Well, think of it this way. Have any of you all had, I don't know if you can dig back to your education days, but chemistry class? Anybody ever remember being in a chemistry class? Okay, well, there's a concept of a fluid being able to hold something dissolved, okay? And it can only hold so much solid in a dissolved state. Another example would be a glass of iced tea. You know, I can put a teaspoon of sugar in an iced tea glass and it will dissolve, but a cup is not. All those granules just sit at the bottom, right? So your body has a certain amount of waste products it has to get rid of every day, regardless of how much fluid you give it. Okay, so let's assume that's a cup of sugar. So if you give your body a gallon of water, it's going to be able to keep all of that dissolved in the urine and you won't form any crystals and all of that stuff will just pass through. But if you get dehydrated and the urine concentrates, then it can't hold all of that dissolved and a crystal will form. And once a crystal forms, it will not dissolve again, even if you drink more fluid. So it's not a reversible process. So that's why dehydration is the biggest thing. The second biggest thing is oxalate in your diet. Most people want to blame calcium in your diet, but it's not calcium. Even though most stones are made of calcium and oxalate, it's dietary oxalate that's the big thing. And the South is considered the stone belt. I don't know if any of y'all knew that, but we form more stones per capita than any other part of the country. And there's two theories for that. One is that we're a warm climate, so people are going to be dehydrated more. And two, we drink a lot of iced tea. Anybody here drink a lot of iced tea? Okay. Iced tea has a lot of oxalate in it. And so when you drink a lot of oxalate and then it passes through your body and when it gets into the bladder or in the kidneys, it combines with calcium and then it forms the crystal and that's how you form the stone. So other high oxalate containing foods, the big ones, iced tea, dark colas, your citrus fruits like orange juice, grapefruit are high in oxalate. Cranberry juice is very high in oxalate. Everybody thinks cranberry juice is the panacea for the urinary tract, but it's not if you have kidney stones. It is if you have infections. Other things that are high in oxalate are spinach and some of your other greens, nuts, strawberries, rhubarb. Actually, rhubarb is the highest containing oxalate food that there is. If anybody has ever made strawberry rhubarb pie, when you boil the rhubarb and you get those crystals on the outside of the pan, that's the oxalate crystals. So I would not go on an iced tea, spinach, nut, and strawberry rhubarb pie diet, unless you want to come see me. And then I'm happy, you know, because the stones are kind of fun from my end. Okay, and a hint to prevent stones is anything that has citrate in it. So the easiest ways to get citrate in your diet are lemonade or the light-colored sodas. So we used to actually put people on a liter of lemonade a day if they were chronic calcium oxalate stone formers, if they had low citrate, if that was their problem. Yes?
Which one do you want?
What now? Can you repeat that?
Where do you want it?
Oh, for strengthening? Okay, the Kegel exercises specifically, or how it relates to incontinence? Okay, that if you have to go to the bathroom and you have a hard time controlling it, that falls in under overactive bladder and urge urinary incontinence. The other symptoms of overactive bladder are going frequently, going urgently, getting up in the middle of the night to urinate. Those are all behavior problems of the bladder. It's trigger happy. So the way that exercising the pelvic floor helps that is, number one, the pelvic floor muscles are the muscles that control these natural impulses that come from the bladder. Okay? The other way is that it actually trains your bladder to relax. And I'll explain that in a way you will all relate to. We've all driven down the highway and we have to go to the bathroom and there's not a bathroom nearby, right? So what do? We kind of squeeze our sphincter for a second so that we don't pee on ourselves. And guess what? The urge to go to the bathroom goes away. Now, it's temporary, But what has happened is when you squeeze the sphincter, you send a signal to the spinal cord, which sends a signal to the bladder telling it to relax, that there's not a bathroom nearby. Okay? That's what it does. So if you do that systematically through continual exercise, you actually train your bladder to be calm. If you systematically do, like for example with Kegel exercises, now you do not want to do them while you're on the toilet. I will tell you that. You do them while you're watching TV or at a stoplight or here listening to me. You don't want to do them while you're urinating. But you squeeze, hold 5 to 10 seconds, then let it go. Do that 5 times in a row, and then an hour later do it again. Try to do about 50 of them total in a day. As your pelvic floor gets stronger, you can do them in larger groups, but start out with 5. And that will help to calm down the bladder. Did I answer your question? Or did I just confuse you?
Well, no, but if you sit there and try to hold it, you might not see.
Right. Yeah, don't hold it. We urologists are very against people holding their urine. We call it nurse's bladder or teacher's bladder. Any nurses or teachers in here? Okay, you all know you go long periods of time without urinating, you can ruin your bladder. Now, you guys are all retired, so it's probably too late for me to counsel you on this, but it's not a good idea to go long periods of time without urinating. You can create a floppy, non-functioning bladder. Any other questions?
Yes, I had one. She wants to know, then to keep your bladder healthy, and to not have the stones developing, all that drug trash, how much water or fluid should you drink in a day, and should it be water? You said lemonade is good.
Very, very good question.
Is Crystal Light?
Yes. For anything that has citric acid in it, so anything that is lemon flavor will have citric acid in it. So Crystal Light, Sprite, 7-Up. Actually, one of my partners swears that all the Mountain Dew he drinks is because he's trying to prevent stones. But I think he's just, rationalizing. But
How much?
well, here's the we all say you should eat 8-ounce glasses a day. The truth is, the easiest way to do it is by the color of your urine. You want it to be dilute, and you can tell that by the color. Now, when you first get up in the morning, it's going to be dark. That's normal. Don't worry about the first morning. But after that, it should look like lemonade. It should be very pale. If it looks like apple juice or iced tea, you're way behind the curve. So I think that's the easiest way to do it. You could start out with that. I personally don't think 8 glasses is enough. And your question about water. Water is the best, but some people don't like water. And if I set a glass of water in front of you and told you you had to drink it and you absolutely don't want to drink it, guess what? You're not going to. So find something that's not bad for you that you like the flavor of. For example, I drink a lot of Arizona green tea. I mean, it's mostly water, but I like the flavor of it. So I know that I'm not putting bad things in my body, but I'm also increasing the amount of fluids that I drink so that I can make lots of urine.
But it's tea, didn't you say that tea is...
Yeah, but it's green tea. Black teas are the ones that are the worst. Most tea that you get at Sonny's Barbecue, for example, is black tea. And it's very high in oxalate. Green tea is it still has some oxalate, but it's much lower than your Lipton's. You're welcome. Any other questions? Yes?
Where do I see drinking lemonade be worse than the world?
Yes. Well, that's a completely different scenario.
But I mean, what are you supposed to do if you can't you're saying drink a lot of lemonade.
Right.
But
Someone who forms stones and has interstitial cystitis should not drink lemonade. Okay? But you can drink water.
Lots of water.
See, the thing is, there's no such thing as a panacea. Everything has its pluses and minuses. Cranberry juice is an example in urology. It's good for urinary tract infections, it's bad for IC, and it's bad for stones. So it just depends on what your goal is with it. Any other questions? Anything else you want me to talk about? Yes, ma'am.
Okay, I was talking earlier about the mesh, when
Mhm.
you have your bladder tacked up. What is the difference between, what would make the difference between putting a mesh in and putting that sling?
Sling. Mhm.
What
Okay.
would make the difference?
Okay, well, let me give you a little history about, because I know you all see those commercials on TV that make it sound like a virus that's eating through you, right? Okay. There's different things that we do in the vagina, okay? For incontinence, a sling, a mid-urethral sling, does use a ribbon-like shaped piece of mesh that goes under the urethra. Now, we also fix bladders falling down, which is called a cystocele, or rectums falling down, which is called a rectocele. Now, back about 10 years ago, it was very popular to use mesh for those repairs, which was actually fixing a cystocele or a rectocele. Now, the plus was that those repairs actually did hold up better than the traditional repairs. I mean, everybody knows someone who's had their bladders tacked 3 times, okay? So, as medicine, we're trying to find better ways to do things. The problem is that the vagina is a unique environment, it's a unique tissue, and it needs to stay very pliable and movable, particularly for intercourse. You know, if you have a hernia repair, your groin doesn't move very much. It doesn't need to move very much. I mean, your leg moves, but it doesn't have to endure a lot of flexibility. The vagina does. The earlier kits were also heavier meshes. You know, I told you that there's a lot of science behind the diameter of the thread, the size of the pores, the weight of the mesh. And so we did have some problems with those meshes getting exposed, eroding, causing pain with intercourse, those kinds of things. So the FDA in 2011 made a comment that said that all doctors and patients should fully discuss the pros and cons of using a mesh to repair prolapse compared to the traditional repairs. That's what the FDA said. Okay, now I will tell you, nothing has been recalled. A lot of those companies who made those kits no longer make them, and very few people do those procedures anymore, because it's become so controversial and it's just not worth it as an individual. So I don't do those repairs, and I don't know anybody else who does those repairs either. But I think the history of it's important to know, because you know, people just think that mesh is bad. Mesh isn't bad. Mesh is just suture. It's weaved suture, and a lot of you, I would imagine some of you in this room have had hernia repairs with mesh, and you've benefited from that because you're not going to have that repaired again. Now, I wouldn't put mesh to do a cystocele or a rectocele repair again, but for a sling, it works awesome, because first of all, that's tissue that doesn't move. The urethra doesn't move. The vagina needs to be able to be flexible, and it might seem like I'm splitting hairs, but anatomically, the urethra is at the very outside part of the vagina, and it's attached to the pubic bone. So just putting some support that holds it there works very, very well. And we don't have all those kind of crazy things that you hear about on those commercials. It can get exposed, but that's usually a minor problem that we can fix pretty quickly and easily. Did that kind of answer? I might have gotten off on a tangent. I apologize if I did.
You were also talking about the stones. Do people who have, a lot of times have kidney stones also get gallbladder stones? Are the two of them related? Is that what you're saying?
No, they are not.
You
They're
don't get
completely
totally
different processes.
Okay.
Kidney stones are, for most people, are a metabolic process, that the way that they metabolize things, they're more prone to stones. A lot of time it's dietary, but it can be just genetics. Gallstones have to do with the liver, which is a completely different organ, and you can have one, the other, or both. They're not related to each other. It's kind of like with the prostate. The two things that we worry about with the prostate are BPH, which is enlargement of the prostate, and prostate cancer. They're not related to each other either. They just both happen to happen in the prostate. So you can have both, you can have neither, or you can have one. But one doesn't increase your risk of another.
Okay.
Does not.
How many kidney stones do you have in a row? What I mean, how many and how?
I have seen people who just non-stop form stones. That's you, huh? Now, do you pass them, or do you have to have somebody take care of them?
Just about them 4 days.
Now, you might have bladder stones. Good question.
It starts up here right on my rib,
Okay,
and it goes down out there where it goes, it gives me more trouble when it goes in my bladder, goes all the way from there down to the bladder.
if you feel it in your back first, chances are that's where it originated. The more stones you pass, the larger the stones you can pass, because your ureter just gets used to it and it dilates.
Probably a lot of times in one a day.
Well, you shouldn't be having that many.
A lot of times-
Chances are we could help you fix that.
A lot of times in one day.
Wow, okay. Do you have a urologist?
No.
Well, how about you get one? We have 7 of them here in town.
She just happens to know one.
I happen to know a really petite female urologist, brown curly hair. She'd love to see you. I also have male partners if you're more comfortable with a man. And then to answer the other question, bladder stones. Bladder stones form most commonly in men because of obstruction. And again, it's a stasis problem, or that there's, as the prostate enlarges, it crimps down on the urethra and it interferes with efficient emptying of the bladder. So men end up getting a little sort of reservoir of urine that doesn't kind of clear out, and so you get some sediment there, and that forms into stones. So that would be the difference between kidney stones and bladder stones, is where they originate. But an x-ray will tell us exactly what you have. Yes, ma'am.
She has a question.
Sure. Go for it.
She just do it like this, and you can't see it.
I also don't have my contacts in, so you guys are all fuzzy.
No, I will ask if you have a hysterectomy, does that affect the bladder and make you go to the bathroom more often or make it drop or something?
Anytime we do surgery on the pelvis, it can affect the bladder. Anatomically, the uterus is the central structure in the pelvis, okay? And it's held there by something called the broad ligament. So, I kind of think of the uterus as sort of like suspended like this, except my arms are real wide. It's got these broad bands that hold it to the pelvic sidewall, okay? The bladder's in front and the rectum's behind. When you remove that, you remove one of the stabilizing support structures of the whole pelvis. So things can start happening then. So things start sagging, they start falling down. So a hysterectomy is a risk factor for prolapse, which is bladder falling down or rectum falling down. It is a risk factor for developing overactive bladder. It is a risk factor for developing stress urinary incontinence. The single biggest predictor of whether you will leak urine with a cough, laugh, sneeze, however, is genetics. So if your mother leaked, you're more likely to leak. It comes down to genes of just about everything, doesn't it?
Forgot to ask her.
Yeah. My mom doesn't leak yet, so I think I'm in pretty good shape. But.
Or does she admit it?
Well, she doesn't leak with the cough, laugh, sneeze. Let's put it that way. She has a little bit of overactive bladder. Any other questions? We have more time, I think, don't we?
No.
No, we don't? We filled it? Okay. Yes, ma'am.
This is really not a question, but he used to have a lot of kidney stones. And this doctor found a little growth on his parapelvic gland up there.
That was causing them.
And they removed that, and he hasn't had one since. That's been a long time.
Yes.
So I just did.
That hyperparathyroidism is a condition that causes kidney stones. It is not the most common reason people form kidney stones, but when we check to see what the stone is made of, and then we do a metabolic evaluation, we check blood and urine, and the blood work tells us that's what it is. That's an easy fix for stones if that's it. So congratulations. 83, awesome. Okay, well, I guess that's it. I'm certainly happy to hang out for a few minutes and talk to anybody who wants to talk to me individually. I did not bring any of my cards. I don't know why I never think of that, but I am the only female urologist in North Florida, so it is not hard to find me. And my name is Eisenbrown. I always tell people it's like Eisenbrown, okay? So if you can remember Eisenbrown and the female urologist, you will find me. So,
Thank you.
all right, thank you for having me, I appreciate it. I'll see you all next month. Dr. Lee will be here speaking about aorta.